Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. How is everybody? I see you in there, Miss Andrea, Cheryl, and Chandria. You guys are my early birds. I know everybody else is going to slide on in here. It is Saturday morning. I appreciate you ladies coming on out and joining us. How are you ladies doing this morning? I want to be sure everybody can hear me. All right. Hey, Miss Cheryl, it is a pleasure to have you in class this morning. You ladies already know we are doing Path and Lab in the medicine section. It's a little bit of a hodgepodge. I am glad you are well, Miss Andrea. I'm glad you can hear me. That's what matters. I got to be sure. All right. So, just to remind you guys, isn't that garden is beautiful. I wish I had a garden like that and I could sit out and just look at it. That yes, oftentimes it is the simple things that bring the most joy. So just pause for a moment and take a breath and live in the moment. I'm glad all is well today, Miss Chandria. All right, for our copyright, CPT copyright 2020, American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, Chun, AMCI Fab 7, AMCI ICD 10, ICD 10, Flip, Tap are trademarks of AMCI. I want to see you guys crush these time scenarios. Yeah, we are ready. Hey, Miss Sonia, good morning to you as well, lady. We're going to start with this first one. I'm going to have Miss Andrea come to the floor. After she reads it, you guys will have 2.5 minutes. All right, lady, the floor is yours.
Okay, coders, we have A 88300, B 88305, C 88307, and D 88309. What is the code for gross and microscopic examination, surgical pathology of breast tissue from a simple mastectomy? Okay, coders, you got this.
All right, coders, if you have not gotten that answer in there, go ahead and get it in there. All right. We are just about, we are just a little over 2.5 minutes. All right, I wanted to be sure everybody had a shot, and I think everybody's gotten this one. Okay, so the answer is indeed C. And yes, everybody got it. You guys came ready to roll. So obviously, you guys already caught it with these keywords. This is a gross microscopic examination. It's surgical pathology of breast tissue from a simple mastectomy. So you're going to head on over to this area in your code book and you're going to key in on breast and simple mastectomy. All right. So we already know that 88300, this is just gross examination only. All right. This is simply with the bare eye. The surgeon is taking a look to see what they have only with the eye. So we already know that 88300, that is off the board. All right. We're going to move on down to level 4. We do have something going on with the breast, but this is for a biopsy and mammoplasty. So 88305, that is off the board as well. We continue on to 88307 for level 5, breast mastectomy, partial or simple. Oh man, that's looking pretty good there. We're going to hold our spot there and do our due diligence and take a look at our last code here, 88309. And this one, hey, that's not what we need just yet. This one is breast mastectomy, but this is with regional lymph nodes. And another thing I want to draw your eye to is you notice as you go up the levels, what is happening is a bit more serious, okay? A little bit more invasive, if you will. So this one, breast mastectomy, but not with regional lymph nodes. So 88309, that one's off the table. And yes, 88307 is a firm code for us. And that is indeed your answer. And all of you got there. All right. So we're going to continue on. If you want a screenshot, you can grab it. And we're going to continue on with your next scenario, coders. All righty, Miss Andrea, you have the floor.
All right, we have A 81000 modifier 26 QW, B 81002 modifier 26 QW, C 81003 QW, D 81001. What is the code and any required modifiers for dipstick urinalysis automated without microscopy performed in a physician office for a Medicare patient? You got this, coders.
All right, coders, how we doing? I think most of you have gotten it in there, and if you hadn't got your answer in the chat yet, go ahead and slide it in there. You guys are doing outstanding. I would say some folks are ready to take that exam. I told you y'all are going to crush it. All right, so indeed the answer is C. All right, we're going to take a look at how we got there. You guys got there in record time, too. Good job on that. All righty, so what are the required modifiers, if any, for this code? All right, and we're going for a dipstick urinalysis automated without microscopy, and it's performed in the physician's office for a Medicare patient. All right, so we already know we're in the proper place because here we have urinalysis. You know, I'm always telling you, use these headings in this book. Make sure you're in the right neighborhood. And indeed, for 81000, this is your analysis by dipstick or tablet regent. Okay. But this particular specific code is for a non-automated with microscopy, and this is automated without microscopy. So that's why this specific code is wrong. But you guys have been coding long enough to know just because this specific code here is incorrect, this common language right before this semicolon, all of this is good stuff and it does fit the bill. So we're going to continue on with this code family and see what else it has to offer. We're going to take the first one off of the board. We're going to take a look at 81001, and you guys already caught it. This was with microscopy, and we do have without microscopy. So 81001, that's no good. All right, the next thing we have is 81002, non-automated. All right, this one is automated. Okay, we're halfway there, but still not quite. So B is incorrect. That leaves us with 81003. That has both, it ticks both of the things that we need, which is automated without microscopy. So 81003 with QW is the code. And why is it the code? All right, we're in this physician's office. Modifier 26 is not required because it's performed in the doctor's office. Okay, so we would not place a 26 modifier on there. Remember, we were talking last week and I was telling you if it's in the doctor's office, then the doctor owns the equipment and everything that goes with it. So we would not need a 26 modifier for that one. But this is a Medicare patient, and we need the modifier QW. It's defined as clear. It must always be applied to a Medicare claim for tests performed in a site with a CLIA waive certificate. So therefore, we know that that one is our answer. All right. So if anybody would like a screenshot, you can grab it. And if not, we're going to keep on rolling. We've got some more coding to do, and you guys are doing outstanding. I'm going to call my buddy Andrea to the floor, and she's going to read your next scenario, and then you'll have 2.5 minutes once again. All right, coders, I know you can do this. Y'all are showing out this morning. You have the floor, ladies.
All right, coders, we have A 82040, 82247, 82248, 84075, 84155, 84460, 84450, 82565. B 80076, 82565, C 80076, and D 80076, modifier 22. A patient presents with right upper quadrant pain, nausea, and other symptoms of liver disease, as well as complaints of decreased urination. Her physician orders an albumin, bilirubin, both total and direct, alkaline phosphatase, total protein, alanine aminotransferase, aspartate aminotransferase, and creatinine. What CPT codes are reported? You got this, coders.
All right, coders, how are we looking in that chat? Look at there. I'm telling you, I am loving it. I think we've gotten everybody's answers in there. If you hadn't put it in there, go ahead and slide that answer in there, and we're going to continue to go along with the answer. You know, I don't like to spill the beans until I got it, but hey, I'm telling you, you guys are just rocking it. Like I said, I knew you guys would crush it this morning. I'm loving the effort. Wonderful job, coders. The answer is B. And you guys, you already know how to get there. All right. So already this patient, they are presenting with this right upper quadrant pain and nausea, symptoms of liver disease. Okay. And they're complaining of also decreased urination. So the physician is going to order this albumin, the bilirubin, both total and direct, alkaline phosphatase, the total protein, alkaline aminotransferase, aspartate aminotransferase, and a creatinine. And I love when they give you like a diagnosis, you're kind of familiar with the various panels. And so you know there is a liver panel. And so you know that's where you're probably going to need to focus your attention first. And indeed, that's where we've got to go. So we've got this hepatic function panel. All right. And so we're going to take a look at our FTRs, and you guys obviously know what to do with it. Okay. All the tests must be performed to use the panel. You're going to report any additional tests that aren't included in the panel. You report those separately. You do not report two or more panels if they have the same test. If you have two panels with overlapping or same tests, you code the larger panel, and then you code the remaining codes separately. So if you don't have this FTR on the one or two of those pages that are related to these panels, you need to put it there. Okay. And this is how I like will like really focus in on certain things just to remind myself. Okay. So we know liver disease, hepatic function panel. Yeah. So we know we need 7 tests, and we've got the albumin and we've got the bilirubin, both total and direct. Boom, there it is right there. We've got that alkaline phosphatase. Yeah, we've got that too. We've got the total protein. Boom, yeah, there it is. We've got the alkaline aminotransferase. Yeah, we've got the ALT or the SGPT. We've got that. And then we've got that aspartate aminotransferase or the SGOT. We've got that as well. So we've got everything we need with that. It includes it all except for the creatinine. Hey, no problem. We got it. We're going to give that a light yes, because we need to continue on, and we're going to hold what we got. So all we need to do, yeah, is add that creatinine, and it is creatinine. Okay, there we go. Creatinine blood 82565. Yeah, we're giving that a light yes. Okay, so we're going to take a look as to why these are not included. We wouldn't list them out like this because they're bundled in a hepatic function panel, and so we would not list them all separately. No, no, no. All right. So with the 887-880-0076, it's missing the creatinine. We've got a code for it. And so we take that one away. With 8007622, we can't use the modifier 22 because we can't say, well, there's one more, so we're going to account for it by saying we increase the service. That would be not applicable. We've got to actually list it. We can't say, yeah, we've got more than 7. We've got to say what that 8th code is for the creatinine. Okay. And so that's why that one's no good. And then we're going to make these firm codes here. And indeed, B is the answer. And you guys got there with no problem. I love it, guys. You guys are, look, I think several of you are exam ready. All right, we're going to keep rolling. I'm going to have Miss Andrea come and read us out for the next scenario. You guys know the drill. 2.5 minutes will be your time after she completes reading the scenario. You have the floor, lady.
All right, we have A 82947, 82947 modifier 91, B 82947, 82947 modifier 76, C 82948, 82948 modifier 91, D 82948, 82948 modifier 76. A 35-year-old type 2 diabetic is feeling weak. The physician performs a stat glucose test in which a finger stick is done placing the drop of blood on a reagent strip. The test indicates the patient is hypoglycemic. The physician gives the patient some glucose supplements and performs another stat glucose test using the same lab test as before 30 minutes later. The second test shows the glucose levels return to normal. How are the lab tests reported? You got this, coders.
How we doing, coders?
We can't hear you, Miss Tamika.
I was answering somebody. I'm sorry. I should have
Oh,
said so.
that's
Miss
okay.
Cheryl, I just sent you a chat. You are good, lady. All right. So I think I've got everybody in there. Thank you, Miss Andrea, for keeping me on track. I muted myself and started typing. So, hey guys, you guys are doing wonderful. Just know that you guys have started out with a bang. All right. So, don't worry. I'm telling you, I'm still sipping on my coffee, okay? And so I was chatting with some of you guys, I think two or three of you, and I was like, no, 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 try again. No, the answer is C, okay? So if I did not give you a follow up in the chat to tell you the answer is C, know that you have it correct. I think I got to all of you, okay? So the answer is C. All right, I've had my third sip of coffee. I think I'm good now. All right, so we're going to take a look at our keyword. So this is a 35-year-old type 2 diabetic The physician has performed this stat glucose test in which a finger stick was done. They have a drop of blood on a region strip. It's indicating that the patient is hypoglycemic. The patient was given some glucose supplements, and another glucose test was performed 30 minutes later. Okay. All right. So we have answer C. And yes, that is a way that you can approach it, Miss Sonia. You can use those modifiers. I'm always telling y'all any way you can narrow that thing down, do it. All right. So this is a stat glucose test, and we need this region strip. All right. So when we look at 82947, this is for glucose. All right. Quantitative blood except region strip. Oh man, I love it when we can narrow it down to 50-50. And already we take two of them off of the board. We are going to take 82947 away. We're going to keep on going because glucose is good. All right. And indeed, it is for this blood region strip. All right. So we already know that is not the issue now. Okay, now these two are the same, but now we've got to figure out what's going on with that modifier. Okay, this physician performed another test. Okay, the same lab test 30 minutes later, so that lets you know it's the same day. All right, so for the modifier 76, this is a repeat procedure or service. All right. So we would not use the 76 modifier. Okay. And again, we need this modifier to indicate the second lab test. Well, 91, it addresses that. It is for a repeat clinical diagnostic laboratory test. Same blood test, same laboratory test, which we had a blood test on the same day. All right, and that's exactly what we had. Another stat glucose, same lab test, 30 minutes later. Indeed, 91 modifier is needed, and that is your answer. And you guys did outstanding. And again, I apologize. I think it was two or three of you guys. My fingers start doing some crazy things. Okay, so you guys already had the answer. It is C. Okay, so if anybody needs a screenshot, you can grab it, and if not, we're going to continue on. You guys are trucking through these things, and you guys are staying on task, hitting it in 2.5 minutes. I'm loving it. All right, Miss Andrea, the floor is yours.
All right, coders, we have A 80050, B 80050, modifier 52, C 85025, 84443, 82040, 82247, 82310, 82374, 82435, 82947, 84075, 84132, 84155, 84295, 84460, 84450, 84520, and D 80050 with modifier 22. You got this, coders.
All right, how we doing? How we doing, coders? All right, I saw some of you kind of going back and forth on this one, and that is okay. That's what study group is all about. All right, it's to helping you to just really refine a couple of things, okay? And so I'm going to help you guys nail this one down, and for some of you to get unstuck. All right, so I get it. Sometimes it's like, yeah, like I think I know. I'm not quite sure, but that's okay. I'm gonna help you to get to be sure and to get unstuck. All right, so no worries. That's the beauty of a small group. I can keep my eye on you guys, and we can just code and get lots of learning in. Okay, so let's take a look at it. All right, this physician orders this general health panel and all the tests except the creatinine, okay, including the CBC with automated differential. All right, so what does that mean? All right, how do we arrive at C? And I know after seeing the last one, you're like, hey, I want to get one of these because it is a panel, but the issue becomes everything except the creatinine. All right. And remember, the one sticking point about that panel is every code that is part of it, every lab test that's part of that panel must be performed. If it's not, you've got to list them all individually. Yeah. All right. So, what is the general health panel? This this group of codes, these particular panels, I would go in and out of understanding it. Okay, but hey, we're going to be sure you guys understand it and stay clear. So, for the general health panel, we can't use it because it's saying everything except the creatinine. The comprehensive metabolic panel is included with that. And with that, all of these tests are included. Okay, so be sure when you see a general health panel, you know that the comprehensive metabolic panel is indeed 80053 and lists all of these codes. The issue becomes we didn't have the creatinine, so we can't code the 80053 because creatinine was not included. So we can't use that panel. All right, so we can't use that. All right, so we're going to take that one off because remember, we got to have everything. Nothing can be left out. All right, so as soon as we know that, boom, all of that, it's gone. We can't, 52 doesn't do you any good. We can't use the 52 because we can't, quote unquote, account for even one code being left out of a panel as reduced. It's all or nothing to report that panel. And so that one's gone. For 80050 with this 22 modifier, it can't be used to increase the procedural services when you're coding more tests or when needing to report each test. So again, all or nothing to report that panel. All right, so we can't adjust it with a modifier. And so already at this point, you have to code each of the tests from the general health panel. All right, so we gotta account for all of them, but we gotta list them out because there's not another panel that we have that includes all of them, and even if it were, it's not included in this scenario. Okay, so we gotta account for it. All right, so we've got the blood complete CBC. That's the 85025 there. We've got, or we have this one, but we have this one. This is the part that used to confuse me. It's either this one with the complete CBC automated and automated differential WBC count is this one, okay, or that one and that one. So in this case, we have this, and then we have this thyroid stimulating hormone, okay? That one's always part of it, okay? The or is between this one and that one. This one is what we need, okay? All right, so everybody with me on that. And then the rest of it, we are just listing it out. The albumin, 82040, the albumin total, 82247, the 82310 for the calcium, the 82374 for the carbon dioxide bicarbonate. We got the chloride for 82435. We've got the glucose for 82947. We've got the phosphatase alkaline for 84075. We've got the 84132 for the potassium, we've got that total protein at 84155. The sodium, we've got that 84295. We've got this ALT SGPT 84460. We've got the transferase aspartate amino, or the ASTSGOT 84450. And finally, we have the bun, the urea nitrogen 84520. Yeah, we got to go down and do each one of them. All right. So as soon as you knew you didn't have that and you looked over here, we can't use it. So boom, it's gone. Doesn't matter what you do with that modifier, you can't make it right. You can't make it fit. Okay. All right. So, how's everybody feeling about that thing now? Yeah, they mean it when they say all or nothing with that panel. So, if anybody needs a screenshot, you can grab it, and then we're going to keep on moving, okay? You guys are doing outstanding. I'm glad, Miss Sonia, you're unstuck, okay? It was a couple of your buddies too. You guys were wavering, and I could see it. And trust me, I've been where you are, where I would be like, like I feel like I can make that thing work. You can't make it work with that modifier, okay? So you guys know it now. You guys are ready, okay? And you know I wasn't trying to trick you, Miss Lisa, but I gotta be sure y'all are stealthy that way and that y'all remain forensic, because I want to see CPCA after all of your names. All right. Okay, I'm gonna have Miss Andrea come to the floor and read us our next scenario. I know you're ready, guys. Let's do this.
Okay, we have A 86927, B 86927 times 4, C 86931, and D 86931 times 4. What are the codes for throwing 4 units of fresh frozen plasma? You got this, coders.
All right, guys, how we doing? How we doing? I think everybody's got their answers in there. You guys are doing such a good job. I tell you, y'all are just making me proud. All right, the answer is B, okay? So here we go. Here we go. We're going to take a look. All right, so we're looking for this code for thawing 4 units of fresh frozen plasma. Okay. And again, this one is simply about keywords and then understanding if and when you need a modifier. Okay. That's it. And some of them are just this simple on that exam. So don't overthink it. All right. So we're unthawing. And this one is fresh frozen plasma unthawing each unit. Each unit. Okay, so when you see each unit, that means that a multiplier is going to come into play because we've got to account for each of them. And when we see each, we're going to do that with a multiplier. So 86927 by itself is not quite enough. So we're going to give this a light yes because we're going to continue on and check out this remaining code to be sure that isn't better. Okay, this is for frozen blood. I'm sorry, frozen blood each unit. All right, so this is frozen, but it's blood and plasma are two different things. Okay, again, just your keyword. So it really doesn't matter what's falling after this because this common code language is incorrect. And please remember that concept on the exam. When you read the common code language, which is everything again, I know I'm repeating myself, everything before this semicolon, if this code language is incorrect, anything that's dependent on that code language is going to be incorrect as well, even if the wording specific to it is okay, like thawing is okay, but this doesn't match, so this is wrong. So 86931, that's incorrect because indeed we have fresh frozen plasma, not blood. So that gets rid of these two. And this one is coding for each unit, which there are 4. So we need this 4 multiplier. Okay, so that's a firm code. And yes, that's it right there. That's all this was testing for. Just keywords, matching that up and understanding what this means in a code each. You're going to need the modifier. Okay. All right. I think you guys, look, you guys were popping those answers in there, and a couple of you kind of were like, like teetering. That's okay. You're clear now. All right. We're going to keep on going because we got some more stuff. I got some more goodies in here. I have a never ending treasure trove. All right, Miss Andrea, you have the floor, lady.
All right, we have A, 88329, B, 88331, modifier 26, 88334, modifier 26, C, 88331, 88332 times 2, and D, 88331, modifier 26, with 88333, modifier 26. Dr. Lee performed an intraoperative consultation on a bile duct tumor requiring frozen section and cytological evaluation to a bladder tumor. How would you report his professional services? You got this, coders.
All right, I'm going to give everybody just a few more seconds on this one. Okay. I see everybody needs just a little bit more time, so I'm going to give you about 30 more seconds and then we're going to start talking about this one, okay? All right, let's start talking about this one, okay? You guys are you guys are close. You're kind of dancing around it, okay? But you are close. Very, very close. So, we're going to unpack this one, all right? And I'm going to show you something about this one. All right? So, here we go. All right, we've got answer D. Yeah. And many of you were really going back and forth with this one, and that's okay. This is a teachable moment, and that is exactly why you are here. Okay, that's why you're here. All right, so Dr. Lee performed an intraoperative consultation on a bile duct tumor frozen section, cytological evaluation to a bladder tumor. How would you report his professional services? All right, so how did we get here? And I'm going to tell you, I rework these scenarios myself right before each class, the different sessions, because I've got other things going on too. And this one right here, I always have to pause. I'm like, okay, let me get my glasses situated. Here we go. All right. So what's the number of specimens that we have? Well, we have two. We've got this bile duct tumor and we've got the bladder tumor. And what was done? Okay, what was done in this scenario? We have a frozen section from the bile duct, and we have a cytological evaluation from the bladder tumor. Okay, yeah, that's right, Miss Sonia. You got to look at that guideline. You got to look at these guidelines. Okay, yeah, Miss Lisa, we're about to have an aha moment. Many of you are. Okay, so we have 88329 and we have this add-on code of 88334. All right, so let's see what we got. We're going to unpack it. 88329, this is pathology consultation during surgery. All right, well, that sounds good enough. Okay, but that's not all that happened, and we always code to provider certainty and specificity, so that one's not quite telling the whole story. All right, so 88331 does a better job of, yes, there was a pathology consultation during surgery, but we had a first block from a frozen section or sections, a single specimen. All right, so that's a good thing. All right. So yeah, first block. And all it's saying is frozen section. All right. Single specimen. All right. So that fits the bill. And that's not the issue because all of them have 88331. All right. Now, what's happening with this second code? And then we've also got this 26 modifier where we know we're going to use it because the professional services. All right. So that's why we have the frozen section. All right. So that accounts for that. Each additional tissue block or frozen section. Well, we didn't have any additional blocks. Okay. No additional blocks. We only had the frozen section from the bile duct tumor. Something totally different happened with this bladder tumor. So the 88332, okay, we don't need that one. That's no good in this scenario. So now we're here. All right, now we've got to do something between this 88333 and the 88334. All right, so this was a sticking point for many of you. All right, so for the 88333, this is cytologic examination. This is either touch prep, squash prep, initial site. Initial site, okay? This one is cytologic examination. This is each additional, okay? Well, this is the first initial site with the cytologic evaluation for the bladder tumor. And look here with these parenthetical guidelines. Use 88334 in conjunction with 88331 and 88333. Okay, so in this case, yeah, we're going to need that because here's the other thing though that is the sticking point, because with this we read this and we think that's pretty good, but this is for each additional site. Okay, we need this initial site, and this right here tells us here for percutaneous needle biopsy require intraprocedural we're going to use this. Okay, nope, nope, but this is the sticking point: intraoperative consultation. Okay, we're going to use 88331 and 88334, okay? But the issue becomes each additional site. We need this one for the initial site, okay? Because we didn't have, I think the sticking point always for me with this particular one, because you know that two things are going on, but they're from two different sites and two different things. This is a frozen section, and this is for a cytologic examination, okay? And so we know that in this case, that's why we need that one. All right. And then the professional component, that wasn't the issue. You guys were clear on that. It was just a matter of seeing cytologic examination. And because you had coded this one, you're thinking this, but that's not so, because this is one frozen section and this is the cytologic evaluation or examination in this case. Okay. And that's why D is your answer. Okay. All right. Yeah, sometimes you can read it too fast because you see what I was reading it. You start thinking this and you're like, yeah, 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 but see, no. You could use it if it applied, but it doesn't. We only had one cytologic prep. Okay? All right. So everybody's good? Okay. All right. I think everybody's good. Okay, everybody's got it. Perfect. Yeah, yeah. Yep, yep, yep. I think you guys are rolling, rolling, rolling. I'm loving it. Okay, grab your screenshot if you need it. I'm glad you guys can see it. Okay. And I know I keep repeating myself, but this particular one, as I always say, some of them you just got to let it simmer. Okay. So grab the screenshot if you need it. Definitely hone in on these parenthetical guidelines. Okay. All right. Okay. So we're going to keep it moving. And I'm going to have Miss Andrea come to the floor. We're going to advance the screen and we're going to do one more from this section, and then we're going to keep on going to our medicine section. All right, lady, you have the floor.
Okay, coders, we have A 86805, modifier 26, 86817, B 86817 with 86821, C 86816 with modifier 26, 86821, D 86806 with modifier 26 and 86817. A patient will be undergoing a transplant and needs HLA tissue typing with DR/DQ multiple antigen and lymphocyte mixed culture. How will these services be coded? You got this, coders.
All right, there's our time. And hey, you guys all got those answers in there. If I still have a few of you that need to pop an answer in the chat, go ahead and do it. All right. And then we're going to start unpacking this thing. Okay, here we go. All right, we have got this transplant. All right, and they're going to need an HLA tissue typing. Okay, and this is with a DRDQ multiple antigen and lymphocyte mixed culture. So the answer is B, and yeah, you guys got this thing. HLA tissue typing DRDQ multiple antigen. We're going to take a look here at 86505, and this is for lymphocytotoxicity assay, visual cross match. We didn't have anything in there that said anything about that. So those keywords, they certainly don't match. We're going to take that one away. All right. And obviously, if this common language for this parent is incorrect, that dependent code is going to be incorrect as well. Let me show my screen to you guys. Okay, here we go. So I've highlighted here the HLA tissue typing, the DRDQ multiple antigen, and the lymphocyte mixed culture. And you guys already know the lymphocytotoxicity assay with the visual cross match. That's no good. These keywords, they do not match at all. And if this parent code with this common language doesn't match, the dependent is wrong as well. And so 86806 that falls under it is incorrect too. All right, so this leaves us now with these two for B and C. So we're going to head on down here to 86812. This is HLA typing. Yeah, that's good. That's good stuff. Now let's get into some specifics here. All right, so we're going to head down to 86817. This is DRDQ multiple antigens. Hey, that's looking pretty good right there. All right, and then we have the lymphocyte culture mixed MLC. Let's see. We've got that mixed culture, so we're gonna put that right there. Okay. And then 86816, this is for the DRDQ single antigen. We need multiple. Okay. And so that's why that one's off the board. And indeed, B is the correct answer. We're gonna give those some firm yeses and check that off. And you guys got there with no problem. All right. So I am loving it, loving it, loving it. We're going to keep it moving. And we're going to head on. Yeah, I want to see what you got. You guys are bringing the sparkle, bringing the shine today. We're going to move on into the medicine section. And I'm going to have Miss Andrea come to the floor. So you guys change gears and let's do this thing, coders. You have it.
All right, coders, we have A 90707, 90716, 90471, 90472 times 3. B 90707, 90716, 90460, 90461 times 3. C 90710, 90460. D 90710, 90460, and 90461 times 3. A young child received a mumps, measles, rubella, and varicella injection at a neighborhood clinic with provider counseling. What CPT codes are reported? You got this, coders.
How we doing, coders? You guys are getting those answers in there. I'm loving it. I'm loving it. Yes, I'm tipping my hat to you, coders. You guys are doing outstanding. Well done. If you still need to get an answer in there, go ahead, put it in the chat. I want to see what you got. Okay. All right. So we're going to go ahead and unpack it. The answer is D. And this is a young child that's received the mumps, the measles, rubella, and varicella injection, all right, at the neighborhood clinic, and they have been provided counseling. So this particular injection is the MMRV. And here for 90707, this is the MMR. So already we can go ahead and take A and B off, okay? Because we've got to account for the varicella, and we don't have to do it individually like this, okay? It's like it's really similar to if you have a combination code, then that's what you want to use. You want to use something that's more inclusive, and we have one that is more inclusive. We actually do have an MMRV that includes all of those vaccines as well as the varicella. So indeed, we are going to use code 90710. All right, so here we are there and there. And that was not the sticking point for any of you. It was making the decision between C and D. All right, so we go on here and we have 90460. That's not an issue, okay? This is for the face-to-face counseling, any route of administration. And we know it's face-to-face, okay, because face-to-face counseling, because it tells us that they had counseling. And we know that this particular patient is under 18 because they say it's a young child. All right. So first or only component of each vaccine or toxoid administered. Okay, so when they say each, remember we talked about that. So we've got to account for each part, each component of this particular injection. Okay, so 90460 is only going to take care of the mumps. We've got to account for the measles, the rubella, and the varicella. All right, so for each additional vaccine or toxoid component, all right, we've got to account for it. So we're going to need this 90460, okay, 90461. All right, we've got to account for each additional. And how many do we have? 3: measles, rubella, and varicella. All right, so MMRV, that one was missing those additional vaccines. And here we have our parenthetical guidelines. The 90460, it's for each vaccine administered, okay? And for vaccines with multiple components or combination vaccines, we need to report the 90460 in conjunction with 90461 for each additional component. All right. There we go. So we've got the vaccine. This is accounting for the vaccine when we talked about the counseling and all that stuff. Now we've got to address the actual vaccine itself, the administration of it. Okay. And so here we have the mumps, and then for the additional 3, we've got the measles, rubella, and the varicella. All right. There are your components, and there's the administration of the actual vaccine. Okay. All right. How we doing, coders? Okay. I think most of you were there. Like I said, the sticking point was between C and D. And for those of you who missed it now, you know you've got to report each additional. I know that this is a combination vaccine. We accounted for that. That's for, again, the components. But then when you talk about the administration, then you have to address the fact that there's more than one component for this particular injection. There indeed 4. So we had to account for all of them. All right. So if you need a screenshot, you can grab it. And then we're going to keep on going. All right. So let's see what our next one is. There we have it. All right. So I'm going to have Miss Andrea come to the floor and read us out on this one as well. Thank you, lady.
All right, we have A 94644, modifier 76, J 7609, J 45.909, B 94664, J 7609, J 44.1, C 94680, J 7609, J 45.901, and D 94640, 94640 modifier 76, with J 7609 times 2 and J 44.1. A 70-year-old patient with chronic obstructive asthma is brought to the urgent care center with increased wheezing and coughing. The provider initiated an albuterol inhalation treatment, one dose delivered by nebulizer. After treatment, the patient's exacerbation was somewhat improved, but the provider determined a second treatment was necessary. What codes are reported? You got this, coders.
All right, coders, how are you doing? From my from my observation in that chat, I think you guys are doing pretty good. All right. I'm loving it. If you hadn't got that answer in there, go ahead and pop it in the chat before we start unpacking this thing, okay? I'm going to give you guys just a few more moments. All right, we're gonna go ahead and start talking about this thing, okay? All right, so here we go. We've got this 70-year-old patient. We're gonna take a look here. The answer is indeed D. If you didn't quite get there, that's okay. You know I'm gonna nudge you in the right direction, and that's exactly why you are here with me on Saturday. So again, you can refine it. All of you guys are right where you need to be. We're just refining it. You guys are some strong coders. We've got this 70-year-old patient with chronic obstructive asthma. The provider initiated an albuterol inhalation treatment, one dose delivered nebulizer. And after treatment, a second treatment was necessary. Okay. All right. So here we go. We're going to take a look at it now. With this one, inhalation treatment, one dose nebulizer. All right. Now, with code 94644, this is for continuous inhalation treatment. with an aerosol medication, but this is continuous inhalation. This is for inhalation treatment with a nebulizer. Okay, so 94644, we're going to take that one away because it's talking about continuous. All right, and don't let these two, it's probably my eyes, but these right here, I was like, okay, now I can take two off. I'm like, wait a minute, no, that's a 94664. All right, so this one right here is for demonstration and or evaluation. Well, we know none of that is mentioned in the scenario, so we're taking that one off the table. Wrong procedure. What about 94680? Oxygen uptake, expired gas analysis. No, no way. That one is gone. Okay, so that leaves us with 94640. Indeed, it's pressured or non-pressurized inhalation treatment. Okay, for airway obstruction for therapeutic purposes and or diagnostic purposes such as sputum induction with an aerosol. But this one, inhalation treatment. What else do we see here? Or nebulizer. Yeah, we've got that nebulizer going on. Okay, so we have do not report, all of these things here. All right, so this is telling us that we don't report 94640 in conjunction with these codes that follow. That didn't apply. But if we have more than one inhalation treatment performed on the same date, we're going to append modifier 76. Yeah, we already know. We already know this is right. So this is letting us know we're right yet again. Okay, second treatment, we're going to need that modifier. Okay. And then these codes that follow, again, when you are on the exam, once you get this lead code and you have eliminated all those and you're sure, go ahead and choose. You can follow this through if you want, but really you don't need to because the 94640 wasn't included in these codes. And you already knew based on your parenthetical guidelines that this was it because it had the modifier as well. So you wouldn't continue when you're on the exam. So let me just really press upon you. Do not continue. Once you're right, you don't need to be right again, again, and again. This is for completeness sake. Okay. So we head on over here. We know this patient had albuterol, and this is J7609. We get to go into the book of, I call it the CPT manuals cousin. All right. So the albuterol, this is 1 milligram. We know we're going to need two of those, and that's what that is. Okay. Because they had the second treatment. And then we follow through with the ICD-10-CM for the J44.1 obstructive asthma, chronic obstructive asthma. Okay. So there we go. With acute exacerbation, that's what happened. And indeed, D is your answer. Okay. So I don't think any of you really had any problem so much with this one or that one. It was with the continuous air trying to, but once you match up, that's why you want to read the code in its entirety. Then it mentions nebulizer, and you know, yeah, that's exactly where I need to be. Okay. All right. So we're going to keep on moving. I kind of did a little rearrangement behind the scenes. I moved a scenario up that I want to be sure we get to before time gets close. So we still have time for a few more, but I definitely want to do this one with you guys. All right, Miss Andrea, you have the floor, lady.
All right, coders, we have A 90969, B 90960, C 90969 times 25, and D 90957. An 18-year-old end-stage renal disease patient is receiving dialysis services and has had two face-to-face visits with her physician within 25 days. On the 26th day, she is admitted to the hospital for inpatient management without a complete assessment. She remains in the hospital unit until the end of the month. Code for the physician services for the 25 days. You got this, coders.
All right, coders, how you doing? All right, I think a lot of you have gotten some answers in there, and we're going to go ahead and get rolling with it too, okay? All right, I think I've addressed everybody and yeah, I've taken a look at everything and I know that Miss Andrea has taken care of all of you guys. All right. So we're gonna go ahead and unpack it. All right. And many of you got there. I just wanted you guys to see this one just to refresh your memory and be sure that you have this concept down. Okay. The answer is indeed C. And so, how did we get there? We've got this 18-year-old ESRD patient or end stage renal disease patient who is receiving dialysis. They've had two face to face visits with her physician within 25 days, but on day 26, she was admitted without a complete assessment. Okay. She remained there until the end of the month. So, we're coding for the services for the 25 days. All right. So, here we go. Well, we have 90957. All right. So this one, what I want you to remember, and I have this one by these codes in my book. Remember that as long as the patient has had a complete assessment, they can bill for a full month of services. But the sticking point is that this patient did not have a complete assessment. Okay, so now what codes could you eliminate because the patient did not have a complete assessment? Well, guess what? You can eliminate those codes that apply to monthly care. Okay, the monthly codes. Okay, you're gonna be able to eliminate those, these that are per month, because no full assessment was done, so we can't code it using those code families there. So 90957, that one's going to go away because again, that's for monthly care. Okay, for development counseling of the patient. Once we see monthly, we don't even have to continue to dig into that code. We're going to go ahead and take it away. Okay, again, this is a timed exam and we've got to be very forensic and we've got to quickly decide which way we're going to go. 90960, okay, again, codes 90957 and 90960 are for a full month of service. This patient has had less than a full month of service and they don't have this complete assessment done. Okay, that's the sticking point. They didn't have that assessment done, so we can't bill for it. Okay, they've had less than a month and they didn't have that complete assessment. This is for monthly, so those are gone already. Okay, once you see this without the complete assessment, that right there will save you some time. Okay, so now we get down to the 90969. Okay, so the code really isn't the issue. It's a matter of if you need this multiplier. Well, this right here is going to help you. Codes 90967 through 90970, they're reported for services for less than a full month of service per day. Okay, so also, patients partial month where there was one or more face-to-face visits, we've got two, and it's without complete assessment. Boom, without complete assessment. So we know that, yeah, that's where we need to be. Okay, so for this one, we have 90969. All right, so here's our code family here. End stage renal disease related services for dialysis less than a full month of service. It is per day. All right, so we have here 90969 because this accounts for this patient's age, 12 to 19. This patient is 18. That's where we need to be. But because it is per day, we need the 25 multiplier. All right, so a lot of you got there. All right. But now you know why you got to be at C. Okay. How's everybody doing? Okay. So, like I said, a lot of you got there, and I think most of you have the concept down, but I just wanted to share these particular sticking points to help you weed through it if you're teetering as to, okay, well, they had some dialysis, but how many days? And then they were admitted. So now this helps you cut to the chase and get to where you need to go. All right, anybody need to take a screenshot? You can do that, and we're going to keep moving right along. All right, coders, and here is your next scenario. Oh, here we go. And then I put their per day codes, the multiplier. You guys already know that, less than a full month. All right, we're going to use that. All right, so here we go. We're going to go to our next one now, and I'm going to have Miss Andrea come and read this next scenario. Thank you.
All right, we have A 90832 90785 F84.0, B 90785 F84.0, C 90882 F84.0, D 90791 90785, and F84.9. A therapist in a residential care facility works with a nonverbal autistic child age 4. In this session, the therapist uses drawing paper and washable markers. The therapist sat with the child and began to draw on a sheet of paper. She gave paper and markers to the child and encouraged the child to draw. The psychotherapy session lasted 30 minutes. You got this, coders.
How we doing, coders? I see some good answers coming in that chat. All right. So if you guys still need to get that answer in there, go ahead, slide it on in there. And then we're going to go ahead and unpack it. And I think you guys have gotten there. Hey, no fooling you guys. And hey, that's never the intent. It's just simply to help you refine your skills. And you guys are so good at this point. You guys are finding those clues and you got your forensic glasses on. I'm loving it. All right, we're going to go ahead with this one. And the answer is indeed A. You guys knew that. This therapist is in a residential care facility and they are taking care of this nonverbal autistic child, age 4. In this session, the therapist sat with the child and they were encouraged to draw. Okay, so the psychotherapy session was for 30 minutes. All right, so here we go. All right. we have code 90785. Well, I love it when they give me an add-on code and it's first because I can go ahead. I don't have to look at anything. It's just gone. All right. So already I have improved my chances right off the bat without doing much of anything. All right. So 90791, this is for a psychiatric diagnostic evaluation. This is for, we're coding for a psychotherapy session. So this was just a matter of matching the keywords. And so, hey, boom, that's gone. All right. And we're going to continue on. Then we have 90882, environmental intervention for medical management. Now, that one's gone. And hey, we're only left with 90832, psychotherapy, 30 minutes with that patient. Psychotherapy session lasted 30 minutes. It is spot on. That's exactly what we need. The 90785 is simply an add-on code. It's for interactive complexity. All right. And it's telling us that we would use this in conjunction with the following codes. Okay. So interactive complexity, it's an add-on code. It's specific to psychiatric services that refer to communication difficulties during the psychiatric encounter. And that's exactly what is happening because this is an autistic child. Okay, so there we go. We're going to use that. And look at there. We're going to use this in conjunction with codes for diagnostic psychiatric evaluation for psychotherapy. Okay, it gives us those codes. And boom, there's our code 90832. So we already know, yeah, we're where we need to be. All right. And so these do not report codes don't apply. And the F84.0 is simply to code for the autistic child. Okay. And so again, you guys already know when you're on the exam, you don't need to go into that ICD-10 CM book unless you've got to break a tie. And in this case, you didn't need to. You already were there with this. But again, for completeness sake, I was just going on to tell you what that add-on code was. Okay. Terrific job. All right. That's right, Miss Sonia. You can start eliminating some stuff. That's right. That add-on code. We're going to keep it going. You guys are blowing me away. All right. So we're going to move on and we're going to take a look at this particular code before we bid you guys goodbye. All right. So I'm going to have Miss Andrea come on to the floor. Let's do it, lady.
All right, coders, we have A 99503, I 50.9, J 96.11, B 99503, I 50.9, J 80, C 99504, I 50.1, J 96.11, and D 99503, J 50.1, and J 80. A patient with congestive heart failure and chronic respiratory failure with hypoxia is placed on home oxygen. Prescribed treatment is 2 liters nasal cannula oxygen at all times. A home care nurse visited the patient to assist with his oxygen management. What CPT and ICD-10 CM codes are reported? You got this, coders.
All right, how we doing, coders? I think most of you have gotten those answers in there. All right. I tell you, I am like a proud mama. Y'all just don't know. I'm about moved to tears. I just can't wait to see your names up on that screen, okay? With that CPCA. All right, guys, let's take a look at what we've got here. All right. Yeah, I had to break the tie. That's right, Miss Sonia. You had to break the tie. All right, Miss Susan, I see you getting that answer in there, lady. I see you getting it in there. All right, here we go. We've got congestive heart failure. And indeed, this patient has chronic respiratory failure along with it and with hypoxia. Okay. They're on home oxygen, and this home care nurse is there to manage their oxygen. So the home oxygen management, here we go. We have a home visit for respiratory care. Okay. And then it gives us examples of what that would entail. And indeed, oxygen therapy is there. So we're good with that. We kind of knew that was going to be the answer because this 99504, I always like to check out that outlier there. This is for a home visit for mechanical ventilation, and we know, nah, that's not it. So, hey, that's good. We've taken that one off the board. So this is one of those scenarios where I said, yeah, you got to pull that big book out. You got to pull the ICD-10-CM out and break this tie, okay? So we see here we have the I-50.9 and then we have the J-50.1. Okay, so let's take a look at these a bit closer. And the I-50.1, that was for this one, okay? And so just for completeness sake, this is letting you know left ventricular failure. And so no, we don't have that going on, okay? So we're going to take that one off. But with J50.9, congestive heart failure, okay? All right, this one here, it should be I-50.9. I'm sorry. Okay, so this one here, this is coding for the left ventricular. This is the I-50.1. So we took this one off. All right, let me get situated. So for this one, we took it off because all these codes are the same. But when we take a look here at J50.1, left ventricular I-50.1, then this left ventricular failure is that doesn't apply. Okay, so we're going to take that one off because we need the one coding for congestive heart failure with hypoxia. Okay, so this one is heart failure unspecified, I-50.9, congestive heart failure, not otherwise specified. That's good, but we need a little bit more. We need to take into account that we have this chronic respiratory failure with hypoxia. Okay, so that's the
Thank you for
J9661.
watching an
Okay, and so we're
AMCI
going to need
exclusive
both.
presentation.
And so the J80, acute respiratory distress, no, we got more going on than that. Okay, that's for respiratory distress syndrome. We take that one off. So no left ventricular failure going on, but we do have a lot going on with the congestive heart failure followed by the chronic respiratory failure. And that's how we break this particular tie. Okay, so sometimes you got to dig in there and sometimes not so much. Okay, so you guys arrived at that answer once you dove in, and you guys did outstanding. I tell you, I love it, love it, love it. All right, coders, I don't know that you have any additional questions for us because you guys were on it today. On it. And we appreciate you guys. And hey, I wish we had more time, but we're on the lead slot. And so I have to share this same channel with Miss Mickey. So you guys go ahead today and take off your watch for the weekend. Relax, enjoy some quality time with your loved ones. Just enjoy it, just even if it's just for a moment, guys. Okay, you guys have been amazing. Thank you guys for hanging out with us and spending your valuable time with us. We appreciate it. You guys crushed it today. Don't forget to leave your feedback or survey for us. Okay, you guys know why it is so important. It does help your instructor help you. It helps AMCI deliver quality classes to you. No feedback means no good. We do want to hear from you. Again, it has been my pleasure. I appreciate you guys so much. I'm going to have Miss Andrea come to the floor because she makes my job so much easier. Come on, lady. Come on.
Hey coders, you guys all did amazing this week, and this has been a great class. I saw a lot of aha moments, and you guys are just doing a really awesome job. I know Ms. Tamika makes this so much easier, but thanks so much for coming out, and I hope you guys have a great rest of your weekend.
Thank you, Miss Andrea. Hey, I am just humbled that you guys continue to hang out with us on Saturday. Thank you so much. You guys have a beautiful day. Leave us your thoughts, all right? And so until next time, we'll be here next week. All things E&M, everybody's favorite section, right? You guys have a beautiful day, and we'll see you next time.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.